Not all blood tests are harmless, especially for seniors. Some can cause serious complications like severe bruising, dangerous bleeding, or even life-threatening reactions. Before you roll up your sleeve, watch this. It might save you or your loved one's life. We're going to reveal exactly which blood tests carry higher risks for older adults, why they can be dangerous, and how you can make them safer without skipping necessary healthcare. Make sure you watch till the very end because I will also be sharing safer alternatives you can go for or recommend to your carer towards the end of the video. You shouldn't miss that part. Blood tests are a critical part of diagnosing and managing health. But as we age, our bodies change, and the way we react to even the smallest needle prick changes too. Seniors often have thinner skin, making veins more fragile and prone to tearing. Reduced collagen, leading to slower healing, weaker immune response, increasing infection risk, circulation changes, making bruising more likely. Conditions like diabetes, heart disease, and high blood pressure make veins and tissues even more delicate. Add medications like warfarin, aspirin, or other blood thinners, and the risk of prolonged bleeding skyrockets. Let's talk about the blood tests that seniors should approach with caution. Now, let's be clear. These tests themselves are not bad or dangerous by design. In fact, they can save lives when done for the right reasons. The problem is, in older adults, our skin, veins, circulation, and healing processes are different than in younger years. This makes certain blood tests riskier and requires more care and preparation. We'll cover what each test is for, the specific risks for seniors, and what safer options might exist. Coagulation tests, PT, INR, APTT. Purpose: these tests measure how quickly your blood clots. PT, or prothrombin time, and INR, or international normalized ratio, are commonly ordered for seniors taking blood-thinning medications like warfarin, heparin, or certain newer anticoagulants. APTT, or activated partial thromboplastin time, is used to monitor other clotting pathways, sometimes for hospital patients or those with clotting disorders. They are essential for preventing strokes, deep vein thrombosis, and pulmonary embolisms, but they involve taking blood, sometimes multiple times a week. Risks for seniors: multiple samples. Regular testing can mean multiple needle punctures over weeks or months. Fragile veins. Older adults often have thinner vein walls, making them prone to bruising and hematomas, large, painful blood collections under the skin. Prolonged bleeding. If the INR is too high, bleeding can continue much longer than normal after a blood draw. Extra concern: seniors with liver disease or vitamin K deficiency may have unpredictable clotting times, which increases risk. Example: imagine a senior on warfarin with a high INR who gets a blood draw in the morning. By evening, they have a large, dark bruise spreading down the forearm, not because the procedure went wrong, but because their blood simply couldn't clot fast enough. Safer options: ask about point-of-care INR meters, small finger prick devices that can test clotting at home with less blood loss. Request experienced phlebotomists who use smaller needles, butterfly needles, and apply pressure longer after the draw. 2. Arterial blood gas test, ABG. Purpose: measures oxygen, carbon dioxide, and blood pH directly from an artery. Commonly done for seniors with chronic lung diseases like COPD, asthma, or during critical care. Provides more accurate oxygen readings than standard fingertip pulse oximeters. Risks for seniors: more painful. Arteries are deeper, have thicker walls, and are surrounded by nerves, making this test far more uncomfortable than a regular venous blood draw. Higher bleeding risk. Arterial punctures bleed more because arteries carry blood under higher pressure. Nerve injury, Rare but possible, and nerve damage can cause pain, tingling, or numbness for days. Circulation issues. Seniors with poor circulation or fragile arteries are more prone to complications. Case story. One elderly COPD patient had an ABG done from her wrist artery. The test went smoothly, but she experienced numbness and tingling in her hand for several days, making it hard to hold utensils. Safer options. If only oxygen measurement is needed, a pulse oximeter or capillary blood gas test from fingertip or earlobe may be less invasive. Request a highly trained respiratory therapist or experienced nurse to perform ABGs if they are absolutely necessary. 3. Multiple tube draws. Purpose. When your doctor orders several blood tests at once, metabolic panel, lipid panel, thyroid tests, vitamin levels, you may have 5 to 7 vials of blood drawn in one sitting. This is common during annual checkups or hospital admissions. Risks for seniors. Fatigue and dizziness. Large draws can temporarily lower blood volume and cause lightheadedness. Post-draw anemia. If large amounts of blood are taken repeatedly, especially in hospitalized seniors, mild anemia can develop. Vein strain. Multiple large tubes mean longer time with the needle in the vein, increasing bruising risk. Practical tip. Ask your doctor if non-urgent tests can be spread over several days to avoid heavy draws in one visit. If multiple vials are unavoidable, drink water before the test to improve circulation and reduce dizziness afterwards. 4. Bone marrow aspiration. Purpose. Used to check bone marrow for cancers like leukemia or lymphoma, or for other blood disorders, such as anemia, that doesn't respond to treatment. Not a routine test, usually ordered when other blood tests show unexplained abnormalities. Risks for seniors. Pain and discomfort. Even with anesthesia, pressure and discomfort during the procedure are common. Infection. Older adults often heal more slowly, increasing infection risk at the puncture site. Prolonged recovery. Seniors may need more days of rest before feeling back to normal. Important note. Should only be done when absolutely necessary and after discussing all other possible diagnostic options. 5. Frequent fasting blood sugar tests. Purpose. To monitor diabetes or pre-diabetes progression. Done after 8 to 12 hours without food to get accurate baseline glucose readings. Risks for seniors. Hypoglycemia risk. Frail seniors or those on insulin or diabetes medications can develop dangerously low blood sugar while fasting, leading to dizziness, confusion, or even fainting. Dehydration. Not drinking water before the test can worsen dizziness. Safer options. Finger prick glucose monitoring. Can be done at home without prolonged fasting. Continuous glucose monitors, CGMs, provide ongoing readings without repeated blood draws. Now, here's something that could save you from a painful or even dangerous experience: a senior blood test safety checklist. This is not just a list, it's your personal defense plan against unnecessary risk. If you're a senior or you care for one, commit this checklist to memory. In fact, print it out and keep it by the fridge or inside a medical folder. Every time a blood test is recommended, use these steps. They can make the difference between a smooth, quick recovery and a complication that drags on for weeks. 1. Ask, is the test urgent or can it wait? Not every blood test is an emergency. Some can be delayed until you're stronger, better hydrated, or when your other health conditions are under control. Example, Mrs. Allen, 78, was scheduled for an iron panel while she was recovering from pneumonia. Her doctor agreed to postpone the test for 3 weeks, and by then, her veins were healthier and easier to access. Why it matters. Seniors with active infections, recent surgery, or poor vein health are more likely to bruise, bleed, or heal slowly. Waiting for the right time reduces these risks. 2. Tell your doctor about all medications and supplements. Many people forget that herbal teas, over-the-counter painkillers, and even vitamins can affect bleeding or healing. Blood thinners like warfarin, aspirin, and clopidogrel are the big ones. But garlic supplements, ginkgo biloba, and high-dose vitamin E can also slow clotting. Example, Mr. Perez, 82, didn't mention his daily fish oil capsules. After a simple cholesterol test, his bruise spread from elbow to wrist because fish oil thins the blood. Tip: write a full list of your medications and supplements and bring it to every appointment. 3. Eat or drink water unless fasting is required. Dehydration is a hidden danger for seniors. It makes veins collapse, making the blood draw harder and more painful. Even if you're fasting, you can usually drink water, and you should, unless told otherwise. Example, Mrs. Green fainted during her fasting blood test because she hadn't had water for over 12 hours. Her doctor now advises sipping water right before the draw. Why it matters. Hydrated veins are plumper, easier to access, and less likely to bruise. 4. Request an experienced phlebotomist. Not all healthcare staff have the same level of skill with senior veins. Don't be shy. You have the right to request someone experienced in working with older adults. Example, Mr. Chen, 76, has very fragile veins. When a trainee tried to draw his blood, it took 3 attempts and left him with a deep bruise. Now his family always politely requests the senior phlebotomist. Tip: phrase it kindly. Could someone who works regularly with older patients do the draw? 5. Keep pressure on the site longer, especially if on blood thinners. For most people, a minute or 2 was enough to stop post-draw bleeding. But if you're on any medication that slows clotting, you should keep pressure for at least 5 to 10 minutes. Example, after her INR test, Mrs. Carter stopped pressing too soon and ended up with a large, painful lump. Holding pressure longer would have prevented it. Why it matters. Seniors' blood vessels take longer to seal, especially with thinner skin and weaker connective tissue. 6. Watch the site for redness, swelling, or warmth afterward. A small bruise is normal, but if you see spreading redness, swelling, or the area feels warm, that could mean infection or a clot. Example, Mr. Peter noticed his bruise wasn't fading but instead turning hard and hot. A quick trip to his doctor caught a small infection early, avoiding a hospital stay. Tip: check the site twice a day for the next 48 hours. Blood tests save lives, but for seniors, safety is about preparation and awareness. This checklist may sound simple, but it's built from decades of lessons learned in clinics and hospitals. Share it with your family, share it with your caregiver, and bring it with you next time you get a blood test. Being proactive is the best medicine you can give yourself. Just because a test is standard doesn't mean it's the only way to get answers. Some tests have gentler, lower-risk alternatives that are especially suited for seniors, and in many cases, they can give results that are just as reliable. Let's explore these safer options. Number 1, finger prick blood tests. What they are, instead of drawing blood from a vein, a small drop of blood is collected from a quick finger prick. Uses: ideal for glucose monitoring, cholesterol checks, and certain clotting tests like INR. Why it's safer? It involves less blood loss, minimal pain, and reduces the risk of bruising or nerve injury. Tip for caregivers: always ensure the finger is warm before testing. Cold hands can make the prick more painful and affect results. Number 2, non-invasive imaging for circulation checks. Example tests: Doppler ultrasound, CT angiography, and MRI angiography. Why it's better for seniors? No needle insertion is needed for Doppler ultrasound, and results are often immediate. When to use? For monitoring peripheral artery disease or PAD, checking for clots, or assessing blood flow in the legs and brain. Added benefit: avoids multiple venipunctures, which can be risky for frail or thin-skinned seniors. Number 3, saliva and urine testing for hormones. Purpose can measure cortisol, certain reproductive hormones, and even some stress-related markers. Why it's safer? No needles, painless, and can often be done at home. Best for long-term hormone monitoring, where daily or weekly sampling is required, like tracking cortisol in stress management or monitoring certain thyroid issues. Number 4, home monitoring kits. Examples: portable INR devices, blood pressure cuffs, and oxygen saturation monitors. Benefits: reduce the need for repeated hospital visits and large volume blood draws. Extra tip: data can be shared with doctors via telemedicine, allowing for quick intervention without the risks of frequent lab visits. Number 5, less frequent testing, only when needed. Why it matters? Seniors with stable chronic conditions might not need blood tests as often as younger patients with fluctuating health. How to decide? Ask your doctor if the frequency can be reduced. Sometimes a test done twice a year is enough instead of every month. Bonus: less stress, less travel, and fewer opportunities for complications. Seniors, your health matters, but how you get tested matters just as much. A blood test should help you, not harm you. Speak up, ask questions, and don't be afraid to request extra care. If this video helped you, subscribe, like, and share it with your friends, family, or caregiver. The more we know, the safer we all are.